prevention starts at a community level. So Drug Free America, by supplying us with information on policies or what's going on in the world and how it influences us, is like key to us influencing community leaders who therefore support us in our efforts to assist individuals and families to gain a life of recovery and health. Drug Free America saves lives. We save lives, they save lives, decision makers save lives, and so we're all connected in this effort to have the healthiest communities we possibly can. And I think Drug Free America will help us educate the community, the local leaders, the decision makers at a state level, certainly at a federal level, about the facts rather than people getting caught up in storytelling.
Business owners look at their insurance very critically because it affects their bottom line, and more importantly, it protects the public. And I'll give you a perfect case. In Texas, a crew leader of a tree trimming company decided that he would get high on alcohol and marijuana. One morning, driving his truck across the lane, he head-on collision with a school bus, killing children and co-workers. You can't have enough insurance for this. I've worked with Drug Free America for 15 years, and the resources that they provide to my clients have been invaluable because all of my clients look at their insurance. Insurance is a big factor in their expenses, and so if you can control those, which the programs that Drug Free America has greatly helped them in several lines. Most people think of workers' comp, and that's a great thing because claims, they strangle your business. Premiums get super high and can take businesses out. We've also seen it in employee dishonesty because unfortunately bad habits cost money. So these employees end up stealing your inventory and your cash. Health insurance, obviously there because the rates go up. And all the things that Drug Free America does helps control the use of drugs and the abuse of drugs in the workplace.
Unfortunately, when you are a school teacher, which I am within the Pinellas County District, we learn a lot more than what we really ever wanted to know from children, especially in elementary school, because they're so uninhibited about what they'll tell you, and they will tell you anything. So it was easy to tell which children were coming from homes that had substance abuse within the home. The nice thing about the Big Nasty program, the Drugs Are Nasty, is that he comes in and even though he makes it fun, he lets them know that that is not normal. When Drug Free America Foundation approached the school and wanted to bring in the Drugs Are Nasty program, my principal was ecstatic. Drug Free America offering this to the community was a great thing because the program allowed children to see that first off, drugs are bad, but second off, that it was not the norm. This was not normal for children's parents to use the drugs that they were using.
But the perception about marijuana is just mainly that it's okay to do, it's just commonplace. You see it a lot in the media and like rap songs and music and movies and TV shows that it's just the thing to do, that it's okay. So when I interned here at Drug Free America, I learned that marijuana is indeed a harmful drug. Additionally, it's the main drug that students my age are being treated for and hospitalized for. One of the things that I did as an intern at Drug Free America was using social media to get our word out there about the negative impact that drugs have on the youth and the public in general. Another thing that we did was we helped to develop the Students Taking Action Not Drugs, which is again the STAND campaign. And we also were instrumental in developing the Don't Roll Up, Roll Out Youth Commission. And the purpose of that was to invite other youth to come out and express how they feel that drugs are negatively impacting their community and to kind of help to inform other people as to why they don't use drugs and why drugs are negative.
Working at the policy level is where you can affect changes that just would reach out to the most people. So we find that you can individually educate consumers, but if you go and change a policy, you might be able to affect thousands of people. The Drug Free America Foundation helped bring coalitions across the state together And one effort was Don't Let Florida Go to Pot. And so we were able to connect with coalitions all across the state with having a common goal of educating people and advocating against medical marijuana because we could find out from Drug Free America Foundation what the effects are in other states that had legalized it. So that's the great thing, is they're able to get the information from states that may have enforced a policy that actually has negative impact, and then we can get the information from them, and then we're able to educate in our own communities so that we won't have that same mistake made here.
She